Okay. Okay. Good afternoon, all. Thank you so much for coming here. I know how hard to find time, especially for all of you high-level staff in China government, to actually come here and listen to our presentation. So today we bring you here to present our project, which is EasyFan, Easy Preventive Care equal a healthy lifestyle. So what is the problem that we are trying to solve here? We have four problems here, especially in China, related to the healthcare system. First, we have the uneven distribution of resources, and then aging society. The third one is the population lack the concept of preventive care, and the waiting time in the hospital is really long. I will go one by one. What I mean by the uneven distribution. So we can see here in urban and rural China, there is uneven distribution of health resources. And in China, we have three tiers of hospital. The first one is the local community, the second one is the provincial hospital, and the third one is the state hospital. Almost all the resources are going to the state hospital, which make people believe that state hospital is better than the local hospital, the local community hospital, or the provincial hospital. And then the second problem is that we have a big chunk of aging society. We can see here the projection that the elderly in China will go rising in the next 3 or 4 decades, and this is bad for us because we have in our society we don't have a preventive the concept of a preventive care and that's resulting in a lot of people coming to hospital for like acute illness. And then also combined with the first problem that there is uneven distribution, a lot of people go to a state hospital and causing this. We can see in the video here, this is only the waiting line in the hospital in China, only the waiting to the registration, not to see the doctor, but this is the waiting line to see the for the registration. We can see how it is such a huge problem with China have a big population and we need a better system. So what is our solution? Our solution is that we will make every day a happy checkup day. How we make that? We will create an EasyFan. So what is in the EasyFan? In the EasyFan, we will have a basic medical supply. We also have a doctor there, nurse, and volunteer that will that will go to residential and then help them to do the annual checkup, help them to do other preventive care or to manage illness that is not too severe, like cold, fever. They do not have to go to state hospital for that kind of illness. And the line before that we see before, it's because they just believe in state hospital. And we will make it easier for them. We come to the residential. They can go and talk to us and then do the checkup and other preventive care. So who is our team here? All of our team are graduates from the Columbia University. MG, he used to work with, he used to be the benefit manager in insurance brokerage industry. He have a really good organizational skill. That's why we want him to be our CEO. And then we have John, who's really good with finance and operating, and he used to work within a consulting company, helping Fortune 100 company to streamline and secure its retail business. And then me, Benny, I will be the marketing, the CMO, because I used to handle the marketing in Unlimited Indonesia. Also, we have chief researcher that will be Guang Yu Zhou, and he have an experience in supply chain and operation, which will be very vital for our project. So for our mission, we have a long-term mission and we also have a short-term mission. What is our long-term mission? Our long-term mission is to create a culture of preventive care within the Chinese population and make annual checkup accessible to all, starting in the urban areas. We want to make this change. We want people to care more about the preventive care. And then the short term is to democratize the medical resources and make them available by first tackling the imbalance distribution in the big cities. The imbalance distribution is that between the state and the provincial hospital and the local community service. And then our market size. Our market size will be the entire Chinese population. And using a bottom-up analysis, we believe that we can serve 4,200 patients in the first month with maximum capacity. So for the marketing, we will use an old technique, which is word of mouth. We want to target all Chinese population, but we will start with the elderly, and then we will start using social media, targeting their kids, because most of the in China society, children take care of their parents, and we will target the social media for that. And then we also will work with the residential committee. Residential committee is the leader in their residential area, and basically they're the one that decide what happened in that area. So we want to have them as the influencer. And then we also have the partnership with a local hospital. We can help them building the data infrastructure, and it's also in line with the initiative China Healthy 2020 initiative, the new initiative by the president. So this will be our marketing channel, and then next it will be our risk and opportunity analysis. So we will partner with the local hospital, Red Cross, and volunteer. The volunteer can be the medical student because they also need volunteer time to finish their study. And then the risk is their policy changing, and if the program failed, then we will losing our initial investment, but it will unlikely to happen. And then our opportunity here, as we see in the video before, how unfriendly and disorganized right now the healthcare system in the state level hospital, and also our other opportunity is that it is in line with the program Healthy China 2020, which is Chinese government want to make China healthier, and they will also focus on the preventive care. Okay, so for the next slide, I will go to my friend here, John, to give the information.
Hi everybody. So I'm going to talk a little bit about our financial model. We have this next slide here. We have our fixed cost, our operating cost, and our total cost per patient. One thing you're going to want to take away from this is the fixed cost is important, but the real number that's important is the variable cost, which we have listed in our appendix as well, because those are the costs that are going to change. And our enterprise is based, as I'll explain a little bit more in the milestone slide coming up, is based largely on our partnerships that we will form with the local hospitals. So we project, as you can see here, and I'll get into it a little bit more, but after about the 3-month mark, we plan on partnering with one hospital. Now, after the 15-month milestone mark, the financials are going to change. So the partnerships with hospitals will allow them to will allow us rather to lower our costs. How? It will allow us access to personnel that the local hospitals will provide. It'll allow us access to medical equipment, medical expertise that the local hospitals will provide. All these things will lower our, costs from about $3 total per customer to about 70%, 70 cents on the dollar per customer. So if you look here, our initial ask. So what we're asking for is an initial investment of $25,000. What this will get are, like I said, partnerships. It'll get us into a large servicing area. Once we hit our first milestone at the 3-month mark, we aim to be partnered with one hospital, servicing one community, and covering a population size of about 4,000 citizens. At that point, we will ask again for another investment of about $100,000. Following that to our next milestone, at the 9-month mark, we aim to be partnered with 5 local hospitals. The service area will be one whole district, and the covered population will be 150,000 citizens. At that point, we are asking for another investment of $1 million. And taking it to our next milestone, at the 15-month mark, we will be partnered with 10 hospitals serving the greater Shanghai metropolitan area with a covered population of approximately 1.5 million individuals. Why will the local hospitals support us in this venture? Well, the local hospitals are hurting for funds, which does not allow them to service the population as they should. In addition, the data that we will collect from each customer we service will allow local hospitals to build out their data infrastructure and help them in many other ways. And with that,
So that really concludes our presentation, and I'm gonna pick up the stick. And you guys can ask me a question, and I don't need the mic because my voice is loud enough, I guess.
Okay.
Any question?
You want to record it? The Q&A?
Yeah, Q&A.
You want to record it?
Yeah.
Or just...
No, it's fine.
Okay, good.
Question?
Question? Sorry.
Yes. Yes.
Okay, you have question, Farley?
Yeah, I think this is really good. It's a really good initiative, but the country of choice, I think, is very challenging, and some of the numbers didn't really add up. Maybe I was not really following, but from Penny's presentation, she said that the capacity, you can cover capacity of about 4,200 persons per month, and then on this slide right here, you have within 3 months you are covering a sample size of 4,000 persons. So I don't know exactly how you reconcile that.
Great question.
Great question.
That
And
we goes to the appendix.
Okay.
Ah.
All right, so I'm gonna ask this Q&A. So here's a key assumption. We don't know. There's no accurate number, and we are assuming.
Mm-hmm.
So those are the key assumptions. The first thing we're gonna do is we're gonna buy one van, which is gonna cost us $5,000, and each van we're gonna have about 4 volunteers,
Mm-hmm.
right? So 3 medical school students, and then probably 1 doctors or with professional license, so they can monitor us to do the checkups driving into the local community. So assuming one van take four workers working per day, we have 5 minutes checkup, doing blood pressure, collecting the sample data, and assuming taking out all their bathroom break, lunch break, and the slacking off hours, they have 4 effective hours per day, assuming taking out all the inefficient times. That equals 200 patients per day. Now, different months have different days. Some months have 31 days, some months have 30 days. With that said, some months have 22 effective working days, some will have 24 effective working days, some has 20 effective working days. So we're using conservative measure. 200 times 20 equals 4,000. 200 times 21 equals 4,200. So that's why there is a discrepancy, but it's really around that measure. So we are using conservative measure to find out how many people are in the. By the way, you guys can interrupt anytime, and you don't need to listen to. I speak a lot, but those are the conservative measure in terms of finding how many patients. In terms of the cost structure, remember he said about 31 cents.
Let me just interrupt quickly. Are you calculating patient, or are you looking for number of checkups made?
So here's what what I want to show you. Oops. I don't know why I had it open.
The
and,
appendix?
yeah. Did you close it?
No, I didn't close it.
So yeah, it takes a little time now.
No, but you can go to the easy pen, right? There. It's there.
What do you mean?
In the easy pen's presentation, on the last page, there's the appendix there. The appendix.
Yeah, but I wasn't trying to show the appendix though. I mean, it's fine. So what's the?
Yeah, my question was, are you targeting are you measuring, I mean, your unit of measurement, is it number
it's
of
right here.
checkups per day or number of patients? Because if you talk about number of patients, how do you ensure that you're not going to be repeating someone within a community?
That's a great question. So this is why I'm showing this actually. So what happens? This is a typical Chinese sort of community district, right? How I know that? Because I was born here, right? Actually, I was born in this apartment, actually. And this is how it looks like here. This is how it looks like, right? I know that because I was born here, right? Actually, I was born in this apartment, actually. And this is how it looks like here. This is how it looks like, right? This is a business center district right here. This is the metro. And this is basically where residential area is, right? I actually go to this kindergarten and this school. It doesn't show here. But anyway, it's not important. Remember what Benny said about the residential committee? It's right here. What they do is they collect they have all the information about everybody living in this district. So what's their age, what's their income level, all their information. So we're gonna partner up with first person we're gonna go to is them, right? We're gonna ask them, okay, how many old people you have, right? How many people you have, and what is their health status, right? And we're gonna have a sort of like a checkup date. Set up a checkup date with them, and they're gonna pretty much spread out the words to everybody, all people here, and telling them to pretty much come here at this time. So we're gonna drive around here to here and do our checkup. So to make sure there is non-repeating members, right? Non-repeating members here, and we are going to just doing repeating jobs in the next day and the next month. So that's basic idea.
Why do you think that all people gonna buy in your service?
It's free.
What's their
Because
free.
it's easy.
It's free.
And
We
also
go to them. It's free. Why not?
what's their motivation like? And they
Basically-
say they trust the state hospital and they don't trust local or city
Would you-
level hospital.
So
and
here's the
then
question.
It
Why
will
do they
limit
wanna
their
come?
effort to go to they do not have to go anywhere. They
Yeah.
just waiting for the fam to come,
Mhm.
and then it's easier for them. Remember, they're old, so their mobility might be limited. So
Yeah.
it's actually make it way more easier.
There is
for
no
them.
such thing as preventive service in China
Yeah.
at this
Right.
point.
Mhm.
Would you rather waiting on this line, or we come up to
Yeah,
it?
or
Well, they try. I mean, inside their mind, they said, "I'm going to some. I'm going to see some very qualified, very well-known, with high reputation doctors. They trusted them. They don't trust your small van. So how do you build your brand?
No.
Say our van is trustworthy.
Yeah,
I should
so-
come to see you.
Yeah, so remember our objective here is to provide preventive care.
Right.
So we will not accept patient that is have like cancer, 4-stage cancer,
Yeah.
and we will refer them to the state hospital for that. But our goal is the preventive care. So with the preventive care,
What is exactly included in the preventive?
Blood pressure.
blood pressure, annual checkup.
Have you ever done any checkup?
Vitals or like just
Yeah.
basic vitals.
Needle, collecting your blood sample.
Mm-hmm.
So the core of our business is really the data. That's the core value of our business is that after 1.5 year benchmark, after 1.5 year milestone, we're gonna have at least 1.5 million people's data blood sample, and they don't have the data infrastructure.
How do you prevent the moral hazard? As you are increasing patients to the hospital.
We're not. we're not
Because
increasing the
you're
tuition.
checking more people and find out they have units or not,
Mhm.
and you refer them to one hospital.
Yeah, what's the moral hazard here? Yeah.
Moral hazard.
What,
Like,
yeah, what's the moral hazard here?
Yeah.
Like if you just exaggerating the situation of the patients, just by
We're not
Increasing it.
we're not for profit, so we are not making money by referring, nor not making money by not referring. So I don't see the moral hazard here because
No, I
we're not manipulating the data.
no, I'm saying like you're maybe you are not, but how do you prevent your employee?
Uh-huh.
I think if I may just comment, I think his question, if I got him right,
Mhm.
is that the hospital already has like a certain number of turnout on a daily basis, and then
Discover more
and
patients.
that turnout is actually based on the number of people that walk in, just like the video show. The number of people that walk in, the registration, and then have that sort of appointment, do that live with the hospital. So they run a database based on the information they get from their individual departments. But if you're only making your daily referral to add on to that number of referrals, that
Overcapacity.
create burden on the hospital. So you cannot like do exactly what you're trying to prevent. That's number one.
Mhm.
And another side to look at it is why do you think people prefer coming to you when in fact they know that going to the hospital, even though you're gonna say we want to do a checkup, all of that, but the hospital also give preference to people who are within their record. So how will you ensure that the hospital create this partnership with you that
Hospital don't have. By the way, hospital don't have the record.
so who has
There is a lack of data infrastructure in Chinese hospital. It's very disorganized,
Okay.
and everything was done on paper.
Okay.
They give you paper prescription,
Mhm.
prescription,
Mhm.
and it's not really computerized.
Oh, okay.
When was the last time? When was the last time in China? I was going to the doctor.
Yeah, yeah.
So I see that the community you're targeting is like in big cities.
Right.
Have you thought about going to like elder community or like
Right.
lower tier cities?
Yeah. So the reason we choose the tier 1 city is because they have better infrastructure. It will reduce our cost in the first place. If you go to a tier 3 city, they might have a poor condition and there are more people needs help, but the hospital don't have the same access of resources. And without those resources, infrastructure is just insignificantly increase our cost. So that's why we choose top tier cities. Better transportation, better road condition, better, easier to find volunteers, easier to find the local doctor, easier to partner with the local hospital, and all that will reduce our cost.
Your mission is trying to reduce the gap between the first tier cities and second tier, but you are providing services to first tier
So
cities too, and
so
then
remember
that's not really.
so remember the mission. We have 2-tier mission, right? One is I'm trying to get back, but I don't know why.
Your computer's gonna die,
Yes.
die.
It's going to die.
It's gonna die.
Can somebody grab Well to get a charger? Just grab Well. So we have so if you actually you have 2-tier system, right? One is long term and one is short term. The long term is to ultimately solve the entire distribution problem. But in terms of the short term, remember there's also a uneven distribution of resources within big city between local hospital, community hospital, and the state hospital. Right? So that's our short term goal. You're not gonna solve that inequality in 1 year. Any question?
Also, at least this is what we will do as a pilot for a year. It will be in Shanghai, but moving forward, we will go to rural areas.
So I just don't see the specific plan of your land here, like including like how do you recruit the employees, doctors, or volunteers.
So we're not we're not recruiting employee in the first interview. I blame you, David Siegel. I mean Professor Siegel, because we only have 10 slides. Anyway, so the plan is that we are going to partner with local medical school, right? The medical school have medical students, and they have semi-pro ability to do checkup, I guess.
So you're
Doing
cutting out
the
your
blood pressure and heights and collecting the blood sample. So three volunteer, one licensed profession from the local hospital.
But you put your reputation at stake.
Huh?
I said you put your reputation at stake because you're cutting out
We have
your-
we start from scratch, so there's no reputation at first. We have nothing to lose. It's easy then.
And
You're cutting out the medical
Not,
school students.
on a serious note though, that's why we have one profession.
Yeah.
We have one licensed profession, doctor from local hospital or nurse.
They will
From
be
hospital.
supervised by the
They will,
professional.
they will be supervised by the
And
professional.
basically, how else we can create a better doctor? That student, if they will become a doctor in the next 10 years.
I know,
or
but you
the
need to know
95
that
years.
they need a long time like
Yeah,
residency.
and this
Probably
can be
in
their
years.
also their practice because it's not hospital. They will not operate. They will just do a preventive care. That's what I'm saying here.
Pretty much, yeah.
Yeah.
yes, so
There's no, by the way, there's no clinic in China. There is a lack of probably private clinic I can think of, but those are very expensive and 95% more people don't really go to clinics. They go to hospital. But as you can tell, the waiting line on the state hospital is too long. People don't go to community hospital because the resource and everything, all the concerns, they don't really trust the local hospital.